Hey guys, it's Dr. Bickling from Own It Dental. As always, here's my contact information if you need to get a hold of me. And if you guys are enjoying these videos, please do hit that like button. It's right down below, it's like right there, and it'll help me diagnose how much you guys really do enjoy them. Speaking of diagnosis, today we're going to find out how I can tell if a doctor can diagnose and treatment plan correctly before I hire them. So let's dig into it. All right. Recently, I've been getting a lot of requests from some of my clients. And how do you find out when you're looking to hire a dentist if they can diagnose and treatment plan appropriately? And my answer to that question is you simply have to test them. You know, back when I was the boss of 50 doctors, whenever we would hire one, I would give them a test before we got started. I'd give them a series of X-rays, and then I would ask questions about those X-rays. And today I'm going to share some of those with you, as well as some of the questions I might ask, so that I can show you what I'm looking for when I ask these questions. So let's dig into it. All right, so like I said, what I'll do is I'll just bring up some X-rays and I'll have like a Word document or something like that with some questions attached to it. So the X-rays might be like in a PowerPoint form or something like that, and the potential doctor will just go through the PowerPoint, and I'll print out a little Word document with some questions on them, and each question will pertain to a certain X-ray. And so as they go through the PowerPoint, they'll see an X-ray or something like this, and I'll ask a question. What would you do in this situation? First, is the tooth salvageable? Is it not salvageable? You might want to find out what the doctor is thinking, and if they say that it is salvageable, how would they treat it? If they say it's not, which, for my opinion, this is probably not salvageable tooth. But if it's not salvageable, how would they treat it then? You'll kind of want to find out, which direction they would go, because if they instantly go to implants, although implants could be a fine option for this, not all patients are ready for implants, nor can they afford implants. So, if they instantly go to implants, they might be pushing the patient out the door. I can't tell you how many times a week I get patients coming to see me for a second opinion, and I ask them what the first opinion was, and they said the doctor kept pushing implants. And that's a doctor that, although, like I said, implants might be correct or a fine option, it might not be the right option for the patient. So maybe we want to hear the doctor say something along the lines of, well, they have multiple options. We could do implants, or the two teeth have restoration, so a bridge could be appropriate. Certainly, depending on what other teeth are missing, a partial denture possibly, and even doing nothing. And so I would need to interview the patient and find out more information. But these would be the potential options, et cetera, et cetera. That lets you know that at least they're open to other possibilities other than just pushing implants down the patient's throat. Here's another X-ray we used, and I can't tell you how many potential dentists that I've interviewed that said that this tooth was salvageable. So, if you think that this tooth is salvageable, good luck with that one. And, we'll see that crown or whatever you tried to do with that one in your hand not too long. So, so you got to pull up X-rays. Pull up X-rays, from your records where you might have like a little 50-50. Maybe it's a guarded prognosis or a 50-50 prognosis, and just see what these doctors say. Maybe they give you something that you disagree with, and if they keep doing that, then maybe that's not somebody that's right for your practice. Here's an interesting one, so I bring up this one, not that there's anything necessarily wrong with this tooth, but we do know that it's a bicuspid and it's had a root canal. And of course, we're all taught that if it's a posterior tooth and it's had a root canal, it needs a crown on it. So you ask the dentist, what would you do here? And you see how they answer. And, of course, they're going to say, well, the tooth it's a posterior tooth, it's endodontically treated, so it's going to need a crown. Well, what would you tell the patient? Well, I'll tell them it needs a crown. Again, this is one of those scenarios where the doctor's just talking at the patient. Maybe the patient's had this tooth like this for 20 years, right? And if we just start telling them it needs a crown, that's a great way to, build trust with somebody when you tell them that their tooth, which is just fine, needs a crown on it. So in a situation like this, I might have to guide my doctors or say, that's fine. It does need a crown. I agree with you there. But, if this tooth has been like this for 20 years, the patient might not trust you when you say that. So maybe we ask some questions in this case. Maybe I ask the question to the patient. I say, I see that you've had a tooth with a root canal on it. Has a previous dentist ever said anything about that tooth needing a crown? And I use that question a lot when I see things like this. And the patients invariably say, oh yeah, they mentioned it, but I just never kind of got around to it. And then I'll just go, yeah, it kind of does need a crown, Is that something that you're interested in getting done? And then the real objection will come up, right? So, in a situation like this is a kind of a cautionary tale to see how the doctor responds, to see if they're able to communicate well with patients, or if they just go right at the patient, telling them what they need. It's not that the diagnosis or the treatment plan would be incorrect, it's how they go about doing it and how they go about communicating what the patient needs to the patient. Here's another one I would bring up too, and again, I can't tell you how many times or how many different diagnoses and treatment plans I've gotten from here, everything from, crown lengthening surgeries and all of that other stuff. And again, you have to decide, if you see an x-ray like this, do you think that tooth is salvageable? And if so, what would you do? If not, what would you do? But just see how the doctors would say that, my opinion, this tooth is probably not salvageable. And also I throw this one in here too, because I want them focusing on this just in case they end up missing this up here too. So I also want to see if they see this one up here. So sometimes throw in an x-ray that has something really obvious in one spot, but something that's a little less obvious in someplace else. And if they do catch this, what would their treatment be there? Would it be simply an MO or an MOD filling? Or do they think that this one potentially might need a root canal? At least if they start saying that it potentially could need a root canal, that shows me that they've been inside of teeth like this before, and that this may not just be an MO or an MOD. That cavity could be a lot bigger in real life. Those of us have been inside of teeth that look like this have found out the hard way. So, if they start saying something along the lines of, oh, it might just need an MO, well, technically they're not incorrect, but maybe they start saying something along the lines of, it potentially could need a root canal. Well, now you know that you've got a doctor that has some experience. So anyway, I like to throw in an x-ray that, shows something obvious in one spot, but something a little less obvious, in another spot, and see if they catch them both. Here's another one that just kind of will help see how they communicate to a patient. And if they see this tooth up here where it looks like wherever the access was almost went out the side of the tooth, maybe there's a perforation or not, just see how they would respond to the patient, see how they would communicate that to the patient, or what they would do in this situation. So that's kind of an interesting one, when sometimes they have to make these hard conversations with the patient. Just see what the words that they would use, see how they would go after it. Are they a robot? Do they just start talking at the patient? Or do they start asking some questions and finding out a little bit more before they just start hitting the patient with some options for this one? But that's a difficult situation right there. Another thing that I really like to do is I like to see how fast they can distill a lot of information down into a very simple treatment plan for the patient. So in a situation like this, this is pretty much an obvious denture case, or implant supported overdenture or hybrid denture or something like that. But in a case like this, I've literally had doctors go, well, tooth number 1 is an impacted wisdom tooth and it needs to be extracted. Tooth number 2 is okay. This is a retained primary tooth with root resorption and missing tooth. And they literally go through tooth by tooth by tooth by tooth. And I'm sitting there for like 10 minutes and they're telling me everything wrong with every single tooth. And then I'm like, well, what needs to happen? Well, you could save this. And, so if you get a doctor that they see a pano and they can't distill a lot of information down into a very simple, let me get that pointer out of the way, a very simple treatment plan very quickly, that's an indication that, this doctor's probably not very experienced. It's probably going to take a lot of time, with their treatment planning. So I do this a lot with panos. I love panos for this because, again, there can be a lot of different things going on, and I want to see how quickly that dentist can turn lots of information into a simple treatment plan. So if you look at one like this, you can see, tooth number 2 here has a lot of caries in it. There could be some periapical radiolucencies here on 3. I'm going through tooth by tooth, right? We have some type of a perioendo thing going on up here. We have some generalized perio problems all around, some cracked teeth, and so on and so forth. But again, I want to see how quickly that doctor can distill all of this information down into a very simple treatment plan quickly and easily. If they can, then you know that you've got somebody with a little bit of experience. If they can't, this person's going to need a little bit of hand holding, or they're not appropriate for your practice. And here's another one again with a lot of different things going on. We've got some perio issues, we have some restorative issues, we've got some large MODBL XYZ amalgams, we've got some broken teeth, a lot of different things going on. And again, I like to use panos as a test to see how fast they can distill a lot of information down into little simple bits. Not even to mention, some of the condyles here, maybe there's temporomandibular issues going on as well. So anyway, can they take all of this information and get to some type of a resolution relatively quickly or not? So these are always good. Panos are always good for that. So how about this pano? I actually had a doctor try to diagnose with this one, but we just know that one needs to be retaken. So. Okay, again, here's my contact information. I'm Dr. Bickling. I hope you enjoyed this video. Get together a bunch of radiographs, some individual bite wings, some periapicals, and even some panos. Put a test together. Make sure that these x-rays are sometimes a little bit 50-50, where they could go one way or the other, but you think they might, go one way, and just see what the dentists will say. Write some questions down on a Word document, give them to the prospective doctor, have them go through the x-rays and see what they say. Based on their answers, you can kind of get an idea of how they would diagnose, how they would communicate to a patient, and whether they can distill a lot of information down very quickly, or if it takes them a long, long time. Those doctors might need a lot of hand-holding, or like I said, they might not be appropriate for your practice. So I hope you enjoyed this video, and I'll see you on the next one. Talk to you soon. Bye. If you enjoyed this video and want to see more content like it, go to ownitdental.com or click the link above and check out my services. I have dozens of hours of training videos, and I've negotiated reduced lab fees for all my clients. So if you want to get out of the dental chair and start owning your business, go to ownitdental.com and check out my services, and I'll see you soon.